record the meeting.
Yeah, it's current.
Is it just transcript or record as well?
It's
recording. That's brilliant. Recording and transcript. So that's recording from now. Okay. So it seems like a while, doesn't it, since we last met? And yeah, things have actually progressed quite nicely. And I'm hoping that I can share with you today some of the progress that's being made over at the new Lubbesthorpe Health Centre site. So I'm just going to flick over into sharing the agenda. Tell I don't do this often. Bring this up. Yeah, agenda is here somewhere. Actions. In fact, it's quite a small agenda, so I won't attempt to mess around the settings. So we were going to do introduction and housekeeping. I think most have attended before, so you know who we are. So I'm Taruna. We've got here operations manager James. Got my colleague Bev as well, who's joined us on MS Teams, and Chris, our head of operations for our primary care network. So I'll try and steer away from abbreviations. Recording and is now in play. Now, there were some action points in the last meeting, which I'm going to now try and share, because that is it. Where can I not find that?
Yeah, that should be.
Okay. There you go. Can everybody see that? It's a Word document. Bev, if you can just shout if you can see it.
Yeah, I can see it.
Yeah,
Okay, thank you. Thanks very much.
Yeah.
So all the green items there are the ones that we've sort of gone back to and answered. So we'll move on to any items that were still remaining outstanding. So starting with the yellow items here. So a lot of these action logs have come from the chat function of the last meeting that we had. So we realized, you know, we were moving along the agenda items, and where people had questions, they were posting them on the chat log. In addition, you know, sometimes we get questions sent to us on our email, and you know, it's because people have then gone home and thought, well, actually, I wanted to ask that question and I should have asked it and I didn't get a chance. And then they ask via then, we try and capture them onto this action log. So we'll just go through these. So there was a question about, you know, asking us, is careful consideration needs to make being made for elderly members of the community who can't access computers or the internet? It's too easy nowadays to insist that everyone uses PCs, or you know, but so a lot of elders are forgotten about, and we absolutely acknowledge that. And I think certainly as a practice, you know, through some of the processes that we've recently gone through, we recognize that, you know, yes, we are a practice who want to be on top of our game in terms of technology and be technology savvy, but let's not forget, not everybody has access or can use various types of equipment and technology. So we completely acknowledge that. And you know, James might want to add a bit more, but strangely enough, we actually had a meeting with a volunteer group today who are doing a lot of work within Leicester, Leicestershire and Rutland, and with practices where they are particularly elderly age group. They're actually sending out, you know, inviting patients to meet with their volunteers to go through what does technology mean to you, and you know, support hand holding through various things.
Well, I don't have it.
No, you don't. So you know, there's that going on, and James and I have received some paperwork today, and we're going to pursue it. I've always also said that if any patients feel that actually after this meeting, Taruna, I'd like to look back at the recording, but I don't have access, I'm more than happy for you to contact me at the practice, and I can arrange for you to come in, and I can play it on a PC for you, so you can go back and look at the recording, and so we're more than happy to make that available to you as well. Does that answer most of the?
So what does that mean? As I don't have internet
Yeah.
or anything.
Yeah.
So how does that benefit me?
Yes. So
But ultimately, you could obviously, coming into the practice, we could obviously show you anything that you wanted to with regard to a PC physically in the practice itself. Alternatively, if you wanted minutes or specific things being sent out into the post, obviously we can do
Yes,
that to you.
I would.
So, anything you request. It's hard for us to disseminate, for example, of course, if we're uploading the minutes, they can be seen by absolutely everyone online. If you were to disseminate the minutes to nearly 16,000 patients, of course, that would be a huge amount of cost.
yeah.
So you have to take it a bit on a demand basis.
Yeah.
So as patients are saying, look, James, Taruna, we just can't access that.
Yeah.
We want to absolutely facilitate that. And,
Yeah.
a bit about when you did the original survey, and we sent out a survey in 1K, we did send out some of those surveys that we didn't have a text message to be able to send the text message to say we'll send it out via paper. And that is some of the learnings there. You can't move everything over to digital without taking into consideration those patients who don't have that.
But I'm not talking about the meeting, I'm talking about the new
An
surgery
appointment.
and appointments and everything.
So yeah, absolutely.
Okay, so what we're going to have, absolutely,
Yeah.
absolutely. I think there's, it definitely is a wider subject. So we're not just talking about meetings, we're talking about access in general for patients to access all services, whether it be digital, whether it be in person, whether it be by phone. And we can try and address some of those and try and answer some of those as we're going along the meeting. Is that okay?
Yeah.
I'm also just conscious, I think last time, some people that are attending the meeting felt it was a little bit unfair that they didn't get a chance to ask questions, and people in the room were asking lots of questions. I think we just need to coordinate it in such a way. So if I can ask people to sort of just hold fire with questions, and we will try and go around the room and around MS Teams on a frequent basis. So the next point was, can we book appointments online, James? That was for you.
Yep, certainly. So the online system is available, and circa 20 to 30 appointments are available at 8 o'clock in the morning every single day, depending on how many appointments we have overall. I suppose the point being there, going back to the point in the room, was that we're definitely trying to move far more things online, so to relieve. So when people who haven't got access online can phone up and get access. So the more stuff we can distribute from the main phone lines coming in, it allows for those people that can't get online to be able to phone up and get through quickly.
I'm trying to get that balance, isn't it?
That's right,
Yeah,
100%.
Thank you. Engage max limit.
Yeah. So I can answer that as well.
Yeah.
So currently, the Engage Consult system online allows you to do 10 medical queries. Sorry, there's something coming up there as well. Sorry, it just came in there. The appointment system is working really well. Thank you so much. You're just coming online. Yeah, the Engage Consult system allows 10 medical queries to come through online, and then an unlimited amount of queries on the admin side. So that could be anything that's not medical. Just to give you some level of understanding, we had 250 separate inquiries came through last month. Again, not making it all up online, but if those queries aren't getting answered via the online system, it's all being diverted onto the telephones, which again makes those queues huge. So again, trying to distribute some of those day-to-day queries, what were blood test results, etc., away from the phones to allow people without access to a website to just phone up. Yeah.
Because I think we have got a number of patients who actually prefer that digital access, and got a number of patients who actually don't want it, and it's about trying to please the wider population in terms of preference. And the next question, currently, are all Lubbesthorpe residents being taken on by Forest Pass Medical Centre? And do we know the split? So James and I had a quick chat about this before the meeting. We can share some net numbers in terms of what we've registered in the last couple of months. In terms of the split, now, we know that a lot of the recent registrations are coming from the new Lubbesthorpe housing. However, we've not done, and we didn't feel to go down the route of doing a postcode analysis, because for us, doesn't matter whether somebody's registering from Lubbesthorpe or registering from Kirby Muxloe. For us, when a patient registers, we want to be able to provide, a good health service to all our patients. We did share last time, naturally, we're not going to register 100% of the residents that arrive in Lubbesthorpe, because some patients will arrive there but prefer to stay with their current GP, whoever that may be. And we know that for a fact. So, if the answer is no, we're not registering 100% of the population that arrives there. People do have a choice of where they want to register. Do you have some numbers?
Yes, so just to give you some, it really has picked up with regard to registrations over the last, since we came out of COVID, really, and we're averaging anything from around 80 to 120, 130 new registrations a month. Having said that, what's important to take into consideration is that you've got a lot of people that are moving out of area for one reason or another. And also, unfortunately, we do have some patients that pass away on a regular basis. As you're probably aware, we do have quite a high, considerable number of care homes as well. So we have 10 care homes. So in terms of how many patients we are actually moving forward with each month, it ranges from around about, it's very hard to get an absolute average, but around about 40 to around about 80 a month. So that just gives you an overall factor. So yes, we are having quite a few new registrations. Definitely kind of over 100-ish. You would have thought, like Taruna just said, that most of those will come via Lubbesthorpe at the moment, because that's our biggest influx, as opposed to nothing's being built at West Forest East. But we do have also people that are moving out of area and unfortunately passing away.
Yeah.
We've got a couple of people with hands up.
Yes. Chris? I'll go to Chris first, and then obviously I can see some other hands as well.
So I attend meetings with Blaby District Council around planning needs for Blaby as a whole. There is a planning assumption that around 70% of the new residents at New Lubbesthorpe will register with Forest House. That's developed on the basis that some people will just be moving around within the Forest House catchment area, but also, as Taruna said, people will exercise their choice and will stay with one of the other practices or will register with one of the other practices. There is another development at Kirby Fields, and again, about 70% of the 2,000 odd, 3,000 odd residents that they're expecting there are going to register with Forest House as well. So there's a significant influx into the practice over the next 5 to 10 years.
Thank you, Chris.
We did have some other hands. Sorry, just bear me a second. I'm just reviewing online. Is that Nari Pranaj? No? Hello? So one other hand
So
up there.
whoever's got the hand up, they can. Do you want to come in?
So I just can't see that all on completely on.
I think it's Nye.
Okay. Hello there, Nye.
Sorry, no, I couldn't see it all online.
No.
Sorry,
Go ahead.
apologise. I was on a works call as well at the same time.
Oh, okay.
Um,
That's all right.
Sorry, no.
Multitask. Just a quick question. On that, is there any limit on the amount of people that will be taken on by the practice in its current situation? I'm just thinking, it's reason for the questions. It's quite difficult to get an appointment, and obviously, as you said, you're getting sort of 80 to 120 people per month coming into the practice. That's going to be sort of put more pressure on the existing services available.
Yeah, I mean, we're not allowed, actually. We are a part of our contract with the Integrated Care Board. We're not allowed to just put a cap or a stop on registering new patients. It's completely against our contract. If we got to a point where we cannot absolutely cope and it got detrimental to, sort of safety and being able to provide proper care to our patients, we would have to put an application in, which would then have to go through the Integrated Care Board, which is our commissioners, for it to be signed off. So it's not as clear as and clean cut as, you know, to stop and start our registration. You know, it's all part of our contract. I mean, but we do, you know, James and I regularly look at, you know, James monitors the registrations very closely now. We are reporting it on a regular basis at our regular partners meetings with the GPs. You know, so they're also well aware, you know, in terms of numbers, because it's obviously an increase of patient registrations for them too. You know, so we are constantly reviewing, you know, that activity. Anything more to add?
Yeah, no, thanks very much for that. Just to clarify, though, I did say you're absolutely right, 80 to 100, 120 on new registrations, take into account people moving out of area, and also, you know, there's patients passing away, unfortunately, and it's around about 40 to 60 in terms of actual net gain, as it were. So it's not quite as big as that headline figure that I've just told you. I did want to tell you that because obviously I wanted to give you a level of what's coming through online as well. So I just replied back to Sarah. Thank you. You replied back to talking about the appointment system. They want to doctors want to review. You'd see you in person a week, but you can't pre-book. Yes, thanks, Sarah. Like I said on that message, I'm also going to be seeing one of the partners this week with regard to looking at the appointment system again. And also, I think, Sarah, you come in there, say taking more patients is a major concern when you can't provide an adequate service to current patients. Sarah, thanks very much. We do send out a survey every month via our online system. We are going to tweak that as well to leave some paper copies in the practice as well. But yes, that's not necessarily what our survey is saying from about the 100 patients that are coming back. But I do understand definitely with regard to the appointment system is a very emotive subject, and that's one that we're constantly looking at.
Because I mean, you know, all beside looking at constant numbers, there's also a demand for face-to-face, and you know, so at the minute, I think we're managing the high volume of numbers and of appointments because you know, some of them are still a triage model, etc. However, if we are moving into, you know, more face-to-face as well, then, you know, that automatically is a knock-on effect of the number of appointments. So we're just trying to really work through, and, you know, all the GP partners invest a lot of time in working with the management team to get that right.
Yeah,
absolutely. I think the next question was, are you proposing patients transfer purpose of the other practice slides? And I think this is referring to where I was showing maps of where the other practices are located. And I think I pointed out on a map where Kingsway and Hockley Farm and I can't remember, was it Ratby, or I can't remember one other. It by all means, not at all. It was all part of building that, you know, information and picture for everyone that, you know, to say, you know, some patients, if they really are not happy, they do have a choice to register, but we're not, of course, we're not going to say, you know, to say to people, go and register somewhere else, but people do have a choice, and that was the point of those slides at that time. So the other one was very surprised the planning department have not asked for travel plans, and this is from the developer. This is standard on all planning applications, etc. So has the developer done the pre-application and also include a sustainable report? The building needs to be very efficient, solar panels, heat pumps, and use EV charging for patients. So I suppose we can get on, sort of move on to that side of the conversation. In terms of travel plans, so I can actually share that the main building plans have been submitted to Blaby District Council. So it's the health centre building plans, as well as the retail units that are being planned to go on ground floor, as well as the care home that's being built on site. So all of that has now been submitted to yes, apparently 66. So all that has now been submitted, you know, to planning. In terms of, I think last time I asked for whether there was a particular travel plan, within that planning application. From what the developer was saying to me, at that stage, they didn't have to submit anything. And I suppose it's still January 24-ish we're looking at. So, but it's not off our radar, that subject. We're going to constantly, there's somebody on the phone here. We're going to constantly be, stay on top of our developer to ask more and more information about travel and how things are emerging with the local authority for public transport. So we're not going to, that's not going to come off the radar. So in terms of solar panels, heat pumps, etc., we are going to start looking at some floor plans today. So maybe we can have that discussion then to see, if there are any greener initiatives that we can as a group propose. So we can look at that. And the next question, did you say how many extra GPs you will be recruiting? Not sure if I shared with you last time. We've actually, touch wood, all the paperwork goes through. We have taken on a salaried GP. Did I share that last time?
No.
I'm not sure I did. So we're recruiting into a salaried GP as we speak. So we went through the recruitment process. We've made the formal offer. And we're just going through, it's as always, never straightforward. We've just got to go through a degree of paperwork. Oh, hello.
Hi.
Got to go through a degree of paperwork to tick all the right boxes and all the contracts and all that side of stuff. So we're looking at hopefully a start date sort of mid-October
So that's
for a
just
new
one.
GP. One at the minute, yeah, one at the minute.
And what does that make us here for the doctors? What numbers?
So
Well,
you'll
that
have
makes 8.
7 GP partners and then 3 salaried GPs.
Bringing it to 10.
Yes.
Not full time though, is it?
No.
No, not 10 full time.
7 partners, 3 salaries.
So,
No.
however, I mean, maybe for another day we can talk further. It's, James and I are working quite hard at the minute in doing a bit of a campaign to promote all the other multidisciplinary roles that we have working in the practice. And they have an important role as well as a GP role in the practice because they do see a lot of our patients as well.
Yeah.
But maybe we can, share a little bit in our next meeting if people are interested. Next question was, I think the video chat should be printed alongside the recording. I think we spoke about that earlier. It's on request. If anybody strongly feels that they want the transcript, please contact us and request it, because it is to get a transcript done from these type of meetings, it takes hours to put together. However, contact us if people do want that. Do practices sort out catchment areas amongst themselves? I think the answer is it's actually no, because what happens is the overall responsibility to provide healthcare in boroughs, in areas, it actually sits with the ICB. So we, wherever our, at the minute where our postcodes sit in terms of where our practices sit, yes, we do have a boundary. And similarly with Kingsway and Glenfield and Enderby, and now if we were, and it's the ICB's responsibility to check that every area is covered, yeah, and that there's no gaps in all of those areas. If we were to then decide actually we want to change our boundary and we want to take off this postcode and that postcode, and it's not it's not easily approved. We get challenged, and again it has to go through a board meeting, and our commissioners are then actually sit down and have a discussion, and they also then say, well, who else is going to then take those patients on, or that area on, I should say. So yeah, we don't just sit and decide our catchment areas alone. The bigger commissioners are involved in that. Okay, I think another one for James. How many backup staff are we going to employ? If you have to ring for an appointment, the message states experience of very high volume call volumes due to COVID. At the time, does this become normal? And at what time does this become normal? And when will more support team be employed at current practice? And what is the plan for number of telephone lines and staff to cover the amount of calls?
Yeah, sure. So peak times at 8 o'clock at the moment. Currently, when we're driving that additional demand, we have around about 5 staff, reception team members and 2 support team managers who are on the phone lines at that moment in time, depending on shift patterns, etc. We have, just to give you some kind of idea of the volume, we're around about, last month we had 9,000 calls come through to the practice that we picked up alone. So averaging around about 500 calls a day is the level that's coming through. In terms of additional support, yes, what we can do is we can certainly look at, and we are going to look at utilising additional staff within the practice to see if we can look at picking up at those during those key times, those key peak times. But also, as hopefully we've demonstrated today, we are trying to leverage the technology a huge amount to try and take away from the phone lines at those very key peak times. There is no silver bullet on any of this, i.e., if you move the time to 10 o'clock when the appointments start, everyone goes through to 10 o'clock. So it's not a case of, there are, and also ourselves, NDB lines, we all work off different appointment systems depending on the doctors and the GPs that they have and their working patterns. So it is quite a complex problem, and it's one that, I really are quite passionate about to try and get it as right as possible. And hopefully what you've seen from the digital side that we've got, that's the be all and end all, I really want to stress that. But the digital side takes pressure off those phones. The key thing is to try and get through those phone lines as much as possible. We can increase it up to 200 lines in the morning, but I think it would be a bit depressing for someone to come on the line and say you're 150th in the queue. So we certainly wanted to keep those lines down, and that's constantly what we're evolving as those patterns change. So hopefully that answers the question.
Thank you. And the final one, could Health Watch be used to take patient feedback? They would presumably be neutral. I think, Chris, do you want to come in here and talk us through how Health Watch could possibly support any of these requests?
Well, briefly, yes. So in one of my other roles, I've got a really good link into Health Watch and the team that supports the county. So Leicester Forest East and Lubbesthorpe are classed as the county. I have made contact with that person to see if they can, and actually inserted the quote from the action log to see if they can help with this. I am yet to receive a response, so if I haven't got anything by the end of next week, I'll be chasing them. But we have picked up that suggestion and are trying to get Health Watch to come on board and see if they can do anything for us.
Lovely, thank you very much, Chris. So before we go on to the next document, I just want to go around the room following those action points. Was there any further questions from anybody in the room?
You mentioned that you've got sort of, say, 20 appointments available online. So if they're all taken up, anybody not online doesn't stand a chance of getting an appointment?
No, we release 40% of our total appointments. Well, I say 40%, 30 to 40% will be released. Now, it depends. I've said I've used 10, 20 or 30. That's of the doctor's appointments available. So depending on how many we've got physically on the day, we only release a proportion. The rest are available.
Yeah, but what I'm saying is the online people, if they take up all the appointments, anybody phoning in, like myself, who can't be online, doesn't stand a chance.
No, because we only release 40%, so there's still 60% of the appointments available to be taken off the phone.
Oh, thank you. That is reassuring.
Yeah, that's it. And we desperately didn't want to take, obviously, because that'd be, we don't want anyone to be in that situation.
I'm in the minority. But...
No, you're not. And honestly, I really want to stress that we absolutely know that the telephone is very, very important. We know that because of how many calls we get through. We're just trying to divert people away who want to go either on their phone or onto a device and then book an appointment online.
Oh, thank you.
So yeah, I just wanted to stress that.
Is there any more questions from online? And James, have we addressed the very last one that came in at 1801.
Written everyone, so everyone's Sorry, Sarah, I'll have to have a look at that. Apologies. I will, yeah, I'll investigate that one because it's quite specific. So thanks, Sarah. Let me just take that away.
Take that as an action. Okay. And again, we'll look through the chat, you know, after the meeting and pick up any sort of action logs from there as well. Okay. And yes, please carry on using the chat function. Right. So actually, I haven't got a slide for this bit, but what I'll do is I'll keep you all on. So there you go. The rules of engagement.
Sorry, of course, yeah.
I've put the rules of engagement and the design as my next agenda item. Now, I've not created a set of rules, but I just wanted to sort of you know, set some standards in terms of what we're about to look at next is the actual floor plans of the new health centre. So I'll share with you, you know, the retail units that are going to be, you know, designed, etc. And obviously, as a relocation steering group, you know, we want to involve as many of you as we can to help us, you know, co-design the new health centre. However, there are going to be restrictions. For example, there's certain, you know, walls that actually hold up various parts of the building that we can't move. The structure and the location of where this is going to be, you know, we can't say we need it moving down, you know, further down the road, etc. So all of those car parking, all of that is actually all, you know, sort of set in stone. But some of the ideas, in fact, came from the previous action logs about, you know, how green is it going to be and looking at access and all of those things. So we can sort of discuss some of that today. Okay. So far, what we've done is that we've had one initial meeting with our developer and the architect. And they were able to share some of these drawings with me. Now, and with these things, of course, I need to try and make this a bit bigger. Now, do tell me if it's still too small. Let me try and get rid of this. There you go. In fact, before I share that one, can I show you another one? Which might help, just so that you've got sort of a visualization of the area and what's going on. Make this a little bit bigger. Right. Is that okay? Can everybody sort of see that? Yeah? Okay. So this is the ground floor area. So we're looking at some storage room there. These are the retail units that I was referring to. Yeah.
So it's not all going to be on one level then?
No, this is all on ground floor.
And the surgery will be above it?
That's right. Yes.
Right.
Yeah, that's right. So down here is, you know, I've been advised that this is going to be quite a nice bistro type restaurant. You know, so we're looking forward to that. Some nice lunches. The retail unit, I believe it's going to be one of the, you know, the high chain, Sainsbury's or Tesco or something. So, you know, that's nice. I think there's going to be other local sort of, you know, retail units and local shops that we can, you know, residents can use out of hours, etc. So that's the design sort of ground floor. So, oh, let me scroll down. So just to put things into perspective, if I scroll down here, and I will make this bigger, and this is all of what you see here is actually the health centre, all of that. And then we've got some extra rooms here, which we're going to overflow into as well. So if I go back into that picture there, and what we'll start is, so I hope everybody can see this. Okay, now I will go on to talking about the left-hand side soon, but the main focus at the minute, if I can draw your attention to the stairwell here. So these are the public stairs. So these are the stairs where the patients will come in, and those that have mobility or want to use the lift, this is where the lift, there's 2 lifts going to be here. So straight away, we've got access doors here. Now I've been reassured that this is going to be electronic door. So, you know, anybody with a sort of mobility or wheelchair need access, then these are going to be electronic doors. And here is an interview, we call it an interview room, but it's almost like a private room. So if a patient comes and says, I'd like to speak to somebody in private, I don't want to talk in reception, then we can meet people in there. The reception desk is here. There's a capacity of maybe two desks or 2 receptionists at any one time. And then at the back here is some desks which colleagues can occupy. At the minute, we don't know who's going to be occupying those desks and which roles, but it's something that the management team with James and I, you know, we're working through some of those logistics. And obviously we want to be be fair to colleagues, you know, that they get a chance to work at Warren Lane and even at Lubbesthorpe. And we want people to be experienced, to be able to, you know, work at either site, you know, for in terms of cover. So just moving along, actually, we can talk about the reception area before we move along. So here is all of the waiting area. And obviously, you know, when James and I were looking at this with the developer, straight away our minds are thinking, oh gosh, where are the patients going to check in? You know, in terms of that check-in screen. What about our information screens that we have, the appointment screens, because we've currently got a news screen running downstairs as well here at Warren Lane. And we want to be able to provide those facilities at the new health centre as well. So when we started looking at this area in a sort of wider and with the input of colleagues like Gary and, as you know, and Bev, who's our IT manager, etc. You know, we actually thought this entrance here, so this is called the patient circulation. You know, we're going to propose that it gets moved to here, so we can almost like have a flush waiting area and the seating area, and then maybe screens can go along this wall here. Depending on how the seats are going, some of them we can have facing this way, or maybe have screens going up. So this is where we're at, basically. You know, this is where we've started to have, you know, sort of think through how's this going to work practically for our patients. You know, so that you can come in and take a seat and have access to information, etc.
Quite a few questions online come through, and I'll just take you through some of these for both of us actually.
Yeah.
So where is the care home in relation? Thanks, Simon. Where is the care home in relation to the shops and the surgery?
There is a floor plan. If I can find it tonight, I'll share it if we've got time. Otherwise, can we move that on to the next meeting? Is that okay?
Yeah.
So
we can have a look at that one. Joe, will there be a pharmacy downstairs?
So the developers haven't shared any further details about pharmacy with us so far, but I believe, you know, that it requires a license of some sort. You know, it's got to be approved as a. I think at this moment in time they're really focusing on the planning of just these main buildings. But I'm sure if you know if they are going to have a pharmacy, that as soon as they've shared it with us, we'll be able to share it with the group.
Okay, so still 2 more to go through. Parking for care home and rest, is it shared? So obviously, depending on where the
care home's going to have their own parking.
And then 2 that I can take straight away. Then we've got Chris briefly. Is two reception desks enough space for the third? We have got 2 reception downstairs, so we're okay with that one at the moment. We'll have a very similar setup as Trina has shared with you, where you will have one of the managers that will be sitting behind the reception team to support them. So at the moment, the 2 there, and then finally from Sorry, there's a couple more. Teresa, the lobby looks quite small and tight for people using lifts and a wheelchair or mobility scooter. We have got the planning team coming to see us next week through a night, and they're going to go through detailed plans in more detail, but we have raised that on our initial meeting. How far through the buildings are the accessible toilets?
Okay, so they're just here. Patient WC, disabled WC. Yeah.
Yeah. And check-in screens need to be more prominent than
Yeah.
reception desk. Yeah,
Yeah.
thanks, Simon. We did take that into
So
consideration.
we're thinking here, check-in screens just as people enter. So what we've actually requested that this wall here, we've asked if it can be, you know, a little bit more straight. So you know, we've looked at that in detail.
Great stuff.
Okay.
There is Chris. Chris is online, but then we'll probably take a bit of a thanks, Simon. That was a thumbs up. Chris online. Chris.
Yeah, I was going to mention the commission of pharmacies. You can't just open a pharmacy or a high street chemist shop wherever you want. You have to get permission from NHS England, who commission them centrally. With a development the size of New Lubbesthorpe, it is likely that NHS England locally are looking at that, at the provision of pharmacists and pharmacy shops within the development. And I would be surprised if there wasn't provision made for a high street pharmacy, excuse my phone, high street pharmacy within the development somewhere. But we can follow that up with the local ICS team and see if they've got any intelligence on that, just to reassure people around disabled access through the site. Any new development now has to pass a Disability Discrimination Act compliance assessment, whereby the council, the planners will come in and they will test the design and they will test the physical building itself, and they have the powers to enforce changes if they're not happy with access. I know this because I had that at a development I did in a previous role. So just to reassure you, the disabled access will be protected and will be assessed at some point during the development.
Thank you, Chris. While we're on this area, I mean, one thing you know, James and I spotted straight away, and I'm pretty sure I've already had this conversation with the developer prior to. Now, as you can see, the lift access is, you know, literally one way. And I've had discussions with them about having doors for the lift here too, at the back of the lift. So now the reason being is, you know, you may have seen before that sometimes we may need to call upon the paramedics. And so currently what the floor plan does is, say if we've had a patient in this room here, number 3, it would mean the paramedics come out of the lift here, go all the way into living in the waiting area, and then all the way down the corridor, and then seeing to the patient. Now, if they happen to, you know, take them away on a stretcher or one of their chairs, what we don't want is that patient then to have to do that journey again, all the way back in. So what I've said is that we need some doors here, you know, and similarly, you know, patients that finish in any of these rooms here, you know, with a nurse, etc., they don't have to come back into the waiting room. They can just exit using the lifts that way. So that's already, you know, we've put that down as a proposal. So moving on down this corridor here, what we've got, you'll see here, is called a group session room. So just to really just give a bit of background to everyone, the way the commissioners work and the people who hold the purse strings and the budgets, etc., is when investment is going into a health centre, you've got to justify every inch of the area, and because every inch, every square foot, every area, you know, you literally, it was, well, what are you going to use that room for, Taruna? And why do you need that many rooms, GP rooms, Taruna? And why do you need that many nurse rooms? And literally the business case that you know, I had to put together had to justify numbers. So I did a lot of number crunching, looking at our patient data, looking at patient profile, and also do a bit of visionary work, you know, that actually, you know, listening to some of the experts that we've got, like the health and wellbeing coach, and the social prescriber, you know, listening to the services they provide. And, you know, there's some real common themes out there of people feeling isolated. You know, sometimes you talk to people about health and well-being, and they're repeating the conversation after one patient after the other. So the idea of this group session room is to provide some group sort of therapy. There's also a demand for new mums as well. You know, new mums who sort of go home with their babies, feel quite isolated. You know, we could do new mums workshops, and they can come in and meet, and you know, and we can get an expert in terms of education on different types of milks and feeding, and, you know, breastfeeding and all those type of topics. So that's the idea of that group session room there. I mean, we really want to try and promote that going forward with the help of, you know, social prescriber, health and wellbeing coach, and, you know, many more, you know, diabetes session, education session, things like that. You know, so we can go into talking about long-term conditions in there, you know, have education on various things. So that's the idea of that room there. So going along further, we'll stick to this side of the room. There's some storeroom here, and here's more office space. So what you see here, this door is basically that, you know, it's going to be sort of secured off, because after that it's all sort of colleagues area. So just on this side, the baby feed room is accessible to patients. This is our IT room. Obviously, that's going to be kept locked, and only the IT experts need to access that when need be. Changing places, and then this terminology threw us a little bit, didn't it, James? But what this is basically a shower room. And I think there's, again, like Chris explained, I think there's now a requirement that we have facilities for even members of the public, patients, to be able to shower if they have an accident, or if they, you know, feel if they were sick down their top, etc. Place to get cleaned up, etc. So we've got that you know, facility built in. Okay, so then from that door onwards, it's obviously this is going to be a secure area. So we've got more office spaces. This is the colleagues exit, also a fire escape. Staff rooms here in the corner. And then here we've got colleagues, you know, room, the restrooms, toilets, etc. So following that staff room, this is where the GP rooms start. Okay. So where you see GP6, GP5, all the way going around here. Now, as you can see, some of them are named registrar room. And again, this is where I was accounting for that, yes, we've got GPs, but let's not forget the, you know, some of the junior doctors that we've got, and, you know, because we are a training practice and we want to maintain that training status. You know, so we've got maybe a registrar, an FY2, etc. So accounting for those numbers. Going down further, so and what this room here, it says non-clinical therapy. So the idea of this room is where we provide holistic therapy, and we find that it doesn't necessarily have to be in a clinical room. So this is where somebody wants to discuss, you know, with us, sort of mental health. Doesn't have to be a clinical room. In fact, it might be more comfortable for them to be in a non-clinical room. So the idea here is to have more soft furnishing in there and make it a lot more, you know, comfortable. I've got social prescriber here and mental health here. However, I'm going to try and encourage that we use more non-clinical rooms for that type of holistic therapy. So going further down here, I've got more GP rooms. And again, that's going to be a clinical room in that in there. So we have to provide our cleaners some storage, and there's a, you know, we accounted for possibly another registrar in that mix there. And then starting here onwards, it's all sort of nurse rooms. So phlebotomy room. Now, phlebotomy room, we have to be specific in terms of its design, because, you know, we have to use a bulky chair, and you know, so, and some people want, you know, not to sit on a chair, want to lie down, to, you know, etc. So designed specifically for that purpose. And then obviously the nurse rooms going along there. And again, the nurse rooms require a lot more storage. They need a lot more things. You know, so that's the idea. So you may ask further down here, what's this going on here? So you may have remembered, it was a while ago, I probably mentioned, so the current plan is actually addressing the first 5 years of the Lubbesthorpe development. So this is designed to accommodate the numbers that are in the population that's being generated for the first 5 years. The plan is that when we start looking at the further next 5 years, because it's a 10-year development, that there's going to be some further expansion, and therefore all this space that you see on the other side is where we could expand into. Okay. As you'll see, we've actually currently got 5 rooms already planned in there. We've requested those specifically because what we want to try and do is, you know, try and, you know, look at other wider services to bring, you know, to the population. So one of the examples is, for example, you know, we've got an external company that actually provides some of the secondary care minor operations, and we're currently offering them our room to provide that service to not just to our patients but to the population. And we wanted that expansion. We get asked all the time, Trina, have you got rooms? We'd like to bring this service to the area. And at the minute, we're really struggling to even accommodate our own. So we envisage that we want to expand, you know, be able to say yes, you know, to the. So it won't be necessarily services that we commission. You know, it might be an external.
So it's similar to Site and Health Centre and Health Shilton.
Absolutely.
Eye injections, hernia
Yeah,
operations.
absolutely. Yeah, hand currently.
Like mole removal.
Yeah, currently hand surgery. You know, it's not, we're not commissioned to do it, but there are, you know, people that can do that under the NHS.
So you rent the room out?
Yes.
Yeah, you
Yes.
rent.
Well, we're not allowed to rent. We're not allowed to rent. No.
So you give freely?
Yeah, well, it gets the expenses of light and expenses get covered.
Well, there's quite a lot online as well, so just to bring it in.
Okay.
So I will. Chris may have seen some of those things that are online. So Chris, I don't know if you want to pick up on anything there. I can go through some questions as well. Chris.
It was just really to build on what Taruna was saying around those additional consultation rooms on the left-hand side of the plan. There is a big push, both nationally and locally, to move what historically have been seen as hospital services out into the community. So moving care closer to home, excuse me, moving care closer to home appropriately. So, for example, it could be an orthopaedic consultation, it could be rheumatology, it could be dermatology. Any of those things can safely and appropriately be delivered within a community setting such as this. And a new build that is built to all the current NHS estate specifications is going to be a perfect opportunity to move some of these services into the community and deliver them out of a building such as this. But there is a big push, as I say, nationally and locally to make that happen.
Yeah, absolutely.
Good stuff. We've got. We'll go through some of these questions. This is going back to the kind of last one really. So what's the backup plan if the lifts fail?
Yeah. So we will have a service contract in place. And obviously we need to look at the contract in detail to make sure that there's an emergency call out, etc. included in that.
And I'm guessing that's why there's 2 lifts as well.
Yes, yeah.
So you've got independence there.
Yeah.
Dependent on a single piece of machinery.
Yeah, that level of detail, Richard, is going to be quite, James and I are going to have to think of all the scenarios, when we get more and more in detail with that. Thank you.
No, this is part of the planning. The developer will need to provide access statement, need to consider what happens in case of a fire. There are only two fire refuge points. Yeah, certainly we'll pick up that one with the developer and the architect with regards to that, because obviously they're going to be very abreast of current fire regulations, obviously.
So just to reassure also, you know, people around the room and MS Teams, that as an organisation, we've chose to have a health and safety package with a company, and you know they come and monitor us regularly and make sure we've got policies and procedures in place. You know, so regular fire alarms. You know, we've got marshals and we've got James. They, you know, does. You test the fires and our evacuation process on a regular basis. So all those things, you know, and similarly, we'll have to put that in place for Lubbesthorpe.
Good stuff. Movable partitions. Should there be an area development for flexible movable partitions in exercise classes?
Yes, so actually, somebody's read my mind. I was actually thinking that because it's going to be a fairly large room, so I was thinking to have maybe foldable doors so we can split the room if you know, we need to just split the room and have lots of things going on. So yeah, definitely, you know, an idea there.
Thanks, Richard. Richard was just about, you know, obviously looking at those fire procedures, certainly. Yeah, and I would look at the fire evacuation plan, definitely work with them in plan with that, like we have to for any building. Obviously, it's a legal requirement. But yeah, thanks for the details on those.
And I'm sure the insurance company will want to see those plans as well. So yeah.
I assume the access to the building is from the car park to the rear rather than from the part that fronts onto the main road.
Because the stairwells at the back on that in the kink of the building, I'm assuming that the doors access, you're not going through one of the retail units to get to it, or are you?
No, I think it's because the access isn't on, from what we're looking at, it doesn't look as if it's on Tay Road, does it?
No.
Yeah. So what we'll do is, as an action point for the next meeting, I'll bring some more drawings.
It might be the other drawing that you scrolled down from, Taruna, actually, that it just might show where the doors were. I was just, I don't know, it's not an important question. I was just wondering, I was thinking, oh, do you walk through the other buildings to get there? Or is it?
Yeah, no, I think they did share something, a sketch with me. It wasn't actually a drawing, to show where the parking for the care home
fits
and parking for the health centre and the retail units and where it all fits in. So I can bring that to the next meeting.
How big is the car park going to be? Because if there's 2 retail units.
Yeah.
I was just going to say, are all these buildings going to be next to the school?
Yes.
Yes.
Home.
Yeah. Well, that.
Yeah.
So you've got a massive problem with car parking. Then
you'll need a multi-storey car park.
I mean, it's horrendous now.
Oh well, hopefully people will
outside the school.
Hopefully people will walk.
No.
You know,
they'll have to walk at some point.
They touch their kids.
Sorry, just keep on point because I'm aware that obviously time's running on and the rest of it. So we will we'll take sorry, just take a few more, but I'm aware that obviously more questions are coming in, so I'm aware of time. So do people exit the GP? Oh, sorry, Teresa said, do people exiting the GP rooms have to go back through the waiting room to get to the stairs? Could the stairs be accessible from the back corridor in some way?
You can actually go around that corner and into the extension space and then back into the lift lobby. So if you look into the bit that's to the left of the thing, it's not on the display at the moment.
No. So we are looking at, so the GP rooms here, so yes, so the corridor here, but they can also go right into, they'll have full access to here as well. So
that was intended to be closed.
Sorry?
I thought that was intended to be closed, the area private.
Yeah, so these doors will have access like a fob system, so the GPs and the colleagues will be able to access into, go and get a coffee, and then finish for the day. They can use the escape stairs to finish and exit the building for the day, etc. So yeah, colleagues will have access. So when I meant by private here, it's public access will stop here.
Yes.
It's that you talked about the lifts having two-way access, so that people would have to go to the waiting room. And I was just wondering whether that would be available for stairs as well. Again, not a huge point, just the.
Yeah.
But again, you can sneak around the left of those lifts and then into this public stairwell.
Yeah, we asked about this stairwell because this was put on at a very later stage. And it's clearly, somebody pointed out, if you've got these clinical rooms here, they need an escape route here.
Yeah.
So these were new to us in that meeting, weren't they? And so in fact, what we've also pointed out, I think the door's in the wrong place. I think we need to do so. But what we can, I suppose, yes, we can, you know, if patients want to sort of finish, either use the lift, but then be able to exit these stairs. I don't see why not, because they are fire exit stairs. But yeah, we'll go into that level of detail, you know, when we have our next meeting with them.
I'm aware of time, and obviously it's people's evening. There has been some questions on there that we can pick up. We've tried to obviously pick up as much as we possibly can throughout the meeting. And aware there's a couple more there, so we can put those on the action log to fill out. Trina, you wanted to go around the room, or do you want to, or at the stage?
So I can't see the full.
No, there's no more hands up at the moment.
Okay. So if there are, you know, questions on prams and push chairs, etc. So if it's okay with everybody, we'll go through the chat here, and anything that we haven't addressed, we'll pick up and try and get another actions log done, if that's okay with everyone. And certainly, you know, some of those suggestions. You know, we haven't had time to maybe, you know, go into in-depth conversation about, you know, the green agenda and what we're doing about that, all of those things. But, you know, hopefully this is work in progress, that we've made a start. If you think of anything, actually, you know, later or during the week, do just post it on the Warren Lane email, and we'll include it as part of the conversation. Is that okay with everyone?
I wondered whether it would be worth for next time. Would it be possible perhaps to do the action log and send that out? So that perhaps we could just see what then needs to be picked up or not. It may be too much work, I don't know. Okay, so the action, I think I did email the action log out with the invite. Yeah. Go with the answers. Read it properly. Right, okay. No, so because we agreed, didn't we, right at the start, that there weren't going to be minutes, but there was definitely going to be an actions log, and we'll continue. So all the green ones that we saw at the beginning, they're going to stay on there. So we've got an audit of things that we've addressed and the things that are outstanding, you know, and so it'd be a big document towards the end. So yeah, no, we'll definitely continue that.
On the car park.
Yeah.
If you've got the plan of the car park, that's fine.
Yeah.
The overspill, when that car park is full, what's the local road?
Sorry, one of the questions was how many, and I think the last number was about 80, so it's going to be quite a big car park. So
but you've got a care home and other things.
No, that's not going to be shared. So it's not a shared car park. Again, I'll bring those sketches in next time. So you
emergency power supply. Because by the time this is built, we may be short of electricity.
Yes. Yes.
A good number of those car parking spaces going to be taken up by staff. Like at
we are. So there is going to be a number of spaces going to be allocated for staff. So the doctors can. Yeah. And nurses can park and start in a timely manner instead of trying to go around the estate looking for parking. So yeah,
if there's a school nearby, I've got a friend who lives near a school, and believe you me, there are no parking availability.
We have, so there is a lot, so a lot on the chat and obviously a lot in the room on parking. So you know, and we do for that because obviously ultimately we want it to be right for patients and for.
So from what I know, and I haven't visualised this myself, is Warren Lane, between Warren Lane and Lubbesthorpe, there is going to be a walking distant path. From what I know.
Warren Lane?
Yes, so from here to Lubbesthorpe, there's going to be
a school
at the end of
on Beggars Lane.
There is, isn't there, Richard? So help me out here. So I've not visioned it myself.
There's a walkway through from Forest House
there
is. That's not very far away.
Yeah. So I, you know, colleagues that have parked here and we say, right, can you go and cover over there? We will say, can you try and walk it? So that we've got.
I know which one it is.
Walkway from Beggars Lane to Lubbesthorpe.
No.
It's quite away.
Yeah. Well, hopefully at some point we'll go for that walk ourselves. When it's all, you know, when we've got something to see.
Are there any plans for the bus a bus route to come through from Hinkley Road to Lubbesthorpe.
So yeah, so that's what I mentioned at the beginning, that that's, you know, the local authority won't design a bus route for something that doesn't exist at the minute. So, you know, the health centre doesn't exist, the shops don't exist,
Right.
but as things develop,
They have put a Vector bus on
yeah, they have.
from the city centre to Thorpe Astley, and it does end at the Lubbesthorpe school.
Yeah, yeah.
But it doesn't help anyone on the Hinkley Road to get the bus.
No, it doesn't. We know that it's not going to, you know, we've not lost our radar on it.
Up and running, that will be dealt with. Oh, great. Yeah. That would help people that are living on the Hinkley Road.
Yeah.
But
well, thanks very much, everybody, for your time. We got slightly over, so apologies for that. But we really appreciate your input and look forward to the next one.
Thank you.
Okay, thank you very much. Thank you.
Thank you.
Thank you.
Bye. Thank you. Bye.
Bye.